heart skipping a few beats? Or is it more like a racing, pounding, or fluttering feeling in your chest that's caught your attention? There are a lot of reasons for heart palpitations, and many of them aren't anything to worry about too much. Maybe you overdid it on the coffee, or you're low in magnesium, or you're experiencing some extra stress these days. Most heart palpitations that are short-lived and don't come with other symptoms like a high heart rate, dizziness, or feeling off can usually be managed at home. We talked with Dr. Singh about ways you can stop palpitations from home and when to see a healthcare provider. Stop your palpitations fast. If your heart is fluttering, there are a few home remedies you can try to slow things down. The idea is to calm your body and give your heart a chance to catch up. Some of the most common triggers for heart palpitations are related to situations that activate that fight or flight response, also called your sympathetic nervous system. That means your body is being triggered to think it's in danger and is gearing up to defend you from whatever it perceives as a threat. Things like too much caffeine, nicotine, stress, and anxiety can kick your fight or flight mode into high gear. You can help calm your racing heart by downshifting into the more cozy rest and digest response, the work of your parasympathetic nervous system. Dr. Singh shares her advice for what to do when your heart beats to its own tune. 1. Try not to panic. Let's say it again. Oftentimes, a random heart palpitation is nothing to worry about, and worrying about what's happening is likely to make it worse. When we worry and stress, our heart rate speeds up as your body enters a fight or flight response. Dr. Singh says, if you're having palpitations and you tense out and your mind races with worry, it's probably going to make the palpitations worse. 2. Take some deep breaths. Deep breathing is one of the best ways to calm your mind and your racing heart. When we fill up our body with oxygen, it helps to let our system know that we're okay. There's no danger here, and we don't need to be on guard for attack, Dr. Singh explains. She suggests the box breathing technique, also called 4 times for breathing. Inhale as you count slowly to 4. Hold your breath for a count of 4. Exhale as you count slowly to 4. Hold your breath for another count of 4. Repeat that pattern a few times. You can try for a higher number than 4. 2. If it feels good. The idea is that you inhale, hold. 3. Try these vagal maneuvers. Another route to calm your heart and activate your parasympathetic nervous system are actions called vagal maneuvers. These physical actions activate your vagus nerve, a long nerve that connects your brain to your belly. It works as your heart's natural pacemaker, and it helps control your heart rate. When it's activated, it helps slow your heart rate and take you out of that fight or flight response. How do you activate your vagus nerve? Try these actions. Tense up your muscles and bear down like you're trying to have a bowel movement. Form your mouth like a letter O and exhale hard, like you're trying to blow through a straw. Keep palpitations from coming back. Identifying any triggers that are leading to your heart palpitations can help you get to the heart of the matter. Once you know what the cause may be, you can take steps to avoid your triggers. Some common causes of palpitations include low electrolyte levels, magnesium deficiency, caffeine, nicotine, alcohol use, feeling stressed, anxious, or nervous. When to see a healthcare provider? In a lot of cases, your random pounding, fluttering, or racing heart is perfectly normal. But if you're experiencing any other worrying symptoms like a high heart rate, pain, or dizziness, it's time to see a healthcare provider. You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.